So good afternoon, everyone. I'm here to present the phase 2A open label study, long-term follow-up after intravitreal MCO10 in patients with advanced retinitis pigmentosa. So synthetic opsin that restores vision has already been published of a study, and you can see there are more than 3,000 mutations in RP, which is being caused uh, by the patients with retinitis pigmentosa, and every gene cannot be addressed. So the answer is a multi-characteristic opsin, which is an biogenetically engineered ambient light sensitive protein, and it can target each and every gene. And it is just injected through an intravitreal injection, and the target is bipolar cells, which is being converted to photoreceptors. And this was the timeline. The inclusion criteria was just perception of light or hand movement in the injected eye, and not better than counting finger in the fellow eye. All the patients are followed up till 52 weeks, and at the end of the study, you can see the primary endpoint included the side effects as well as efficacy of the drug. And all the patients now are in 4th or 5th year post-injection and followed up. And this is the all the features of the 11 patient which undergone genotyping. And you can see the optical coherence tomography confirming lack of outer nuclear layer, and functional measures of the patients are baseline with a non-detectable signal on ERG, and Humphrey showing almost loss of total visual field. The high dose group, which received 10 to the power 7 vector genome per ml dose, showed a significant increase in the visual acuity, which is, as you see, the p-value is less than 0.03. And there was a substantially clinical relevant improvement in NEI FEQ subscales, which with both vision-specific dependency subscale as well as distance activities. And the long-term follow-up shows limited intraocular inflammation after 4 years of follow-up. And the results shows a favorable safety profile was observed through 4 years of MCO-treated subjects, and transient intraocular inflammation and IOP rise in few subjects resolved with minimal intervention, and there is no retinitis, choroiditis, or vasculitis or hypopyon in any of the patients, and there is no decline in visual acuity due to NCO treatment in contrast to the natural history of the disease. And substantially in clinical relevant NEI VFQ score improvements was also observed. The long-term follow-up at 4 years also showed dose-dependent improvement in the high dose group, which was still persistent after 4 years of follow-up also. So based on this, the initial study, they have conducted a multicentric trial in USA at 6 centers, which showed that MCO achieved primary and secondary key endpoints with statistical significance and no side effects. There they have extended the study for the initial 52 weeks showed a good result, and they have extended till 76 weeks in all these 6 centers, which also showed a good improvement in visual acuity without significant side effects or IOP rise. So to summarize, the LAF2 study in RP after MCO injection in phase 1-2A showed that MCO is well tolerated with no reported serious adverse effects. There are no anterior chamber cells or flare, vitreous cells or haze in any of the subjects even after 4 years. No subjects required medication to treat ocular adverse effect at the end of 4 years, and the benefit of treatment effect was observed through improvement from pre-treatment baseline in quality of life assessment activities, daily living using NEI VF25 score. And this initiated a biologic submission for appliance in US FDA, and we are expecting the drug to be available by end of 25. Here is a real life patient, subject number 003, how the patient is able to read the letters in front of my room, and this shows a real life scenario following VMCO injection. And I would like to thank all my team for all those supports during last 8 to 10 years. Thank you very much.